Good morning, I am Gabrielle Baliton, a nursing student from San Pablo Colleges. I am here to do the return demonstration of lungs and thorax. This is to assess the oxygenation of the patient. So first, sir, I am Gabrielle Baliton. What is your name?
My name is Richie Baliton.
Is it okay with you if you are going to cooperate with me?
Okay.
But before that, we need to perform hand washing to prevent the microorganism to spread and um, provide for client privacy like closing the doors and all the windows. Now, first thing to do is to observe my patient's skin and anterior structure while he is sitting comfortably in an examination chair while his hands is on their side. Um, After observing the skin and anterior structure of my patient, I observed that it's all normal. After that, I will observe the position, posture, and ability to support weight of my patient while he is breathing. After observing it, it's all normal, his posture, position, and ability to support his weight. After that, I will check the accessory muscles or the neck muscles while he is breathing. After that, I check the accessory muscles or the neck muscles such as sternocleidomastoid and latissimus dorsi are all normal. Then now I will move to his posterior thorax and lungs. First, I will observe his skin and posterior structures. After observing it, I observed that there is no presence of scoliosis, lordosis, and kyphosis. His posterior structures and skin are all normal. Then after that, I will palpate his spinous process. They must be evenly and non-tender. After palpating it, I observed that my patient's spinous process is perfectly in a line and non-tender. Then after that, I will assess my patient's respiratory expansion while my hands are placing on the posterior chest wall and my thumb at T10 level. Then I will press a small skin fold and observe the movement of my thumb. So sir, take a deep breath. Exhale. After that, I observed that my patient's respiratory expansion have an equal movement of my thumb while inhaling and exhaling. Then now I will palpate the fremitus by placing my ball of both hands. And I will ask my patient to say 99 while I'm moving my ulnar aspect of my hands. And then by this, you will assess the symmetry and vibration of his back. So sir, say 99.
99. 99. 99. 99. 99. 99. 99. 99. 99. 99.
I observed that his symmetry are normal and vibration are present. I will start to percuss using my middle finger in the non-dominant hand and strike it using the two fingers of my dominant hand. Also make sure not to strike the nails because it can alter the sounds. I will start percussing for resonance starting from apices of his scapula and across the top of the shoulder through intercostal spaces across and down until the lateral aspects of the bases of the lungs. Always compare the two sides if there are differences in the resonance and if there are abnormalities present. and I've observed and hear the sounds. It's all equal and normal. After that, I will going to auscultate his posterior thorax while he takes a deep breath, and I will going to prepare my materials and get the stethoscope. After auscultating it, I observed that my patient's posterior thorax are all normal and no abnormality is present. And moving forward, we will begin to assess my patient's anterior thorax and lungs, beginning with the bones and muscles for any retractions and the accessory muscles he used when breathing. Um, There are no lesions present and the bones and muscles are well defined. The skin color of my patient is color brown. After that, I will go into palpate for any lumps and tenderness in the anterior thorax of my patient using my finger pads. After palpating it, there are no lumps and tenderness in his anterior thorax. Then now I'm going to assess the respiratory expansion of my patient by placing my hands on his anterior chest wall and pointing my thumbs toward the um, seaport process, and I will press a small skin fold and observe my thumb movement of my thumb. After assessing it, I observed that there are equal movement of my thumb while inhaling and exhaling. Then now I'm going to percuss his anterior thorax from above the clavicle down to the chest wall side to side. After percussing it, the sounds are normal and there are no abnormalities present. Now I'm going to auscultate my patient's apical pulse while he is on a supine position on 1 full minute. His apical pulse is 85 beats per minute, which is on the normal range. After auscultating the apical pulse of my patient, I'm going to auscultate also the aortic, which is the second intercostal space on the right sternal border, followed by the tricuspid, which is the fourth and fifth intercostal space on the left sternal border, and the mitral valve, which is the fourth and fifth intercostal space, but on the mid-clavicular line. This is to assess and check the heart sound. After auscultating it, observe that the heart sound of my patients are all normal and no abnormalities present. And now I'm going to auscultate the anterior thorax of my patient while using the diaphragm of the stethoscope to check and observe the breath sound. The breath sounds of my patient is all normal and no abnormalities present. And now I am done with assessing my patient's thorax and lungs. You need to perform the hand washing again and document all the procedures you've done. Again, I am Gabrielle Baliton. Thank you.